Some of the table 5.1 includes the theories that are listed here, which can be helpful to organize the content and approach to their concepts. Sigmund Freud had a psychoanalytical type of model. He was the founder of psychoanalysis, which is the belief of the unconscious mind, which is only rarely recognized by the conscious mind. He developed personality theory and the theory of infantile sexuality. Anna Freud and Sigmund Freud further developed their unconscious states into the defense mechanisms, which they coined are coping styles that protect a person from unwanted anxiety, distress, or internal conflict. Transference is a displacement of thoughts, feelings, and behaviors associated with significant others from their childhood onto a person in a current relationship. And when a therapist or a nurse does this on to the patient, then it's called countertransference. Harry Stack Sullivan is an interpersonal theorist who really stressed the importance of human relationships. So the interpersonal relationships that we have with each other is the basis of our development and behavior. So if an individual's personality is determined by how they deal with others, that can lead to a person's health or their sickness. You're likely familiar with Abraham Maslow's hierarchy of needs. Be sure to review each of those different levels of needs, identifying basic needs all the way up to self-actualization. Psychodynamic theories encompasses several different types of theories, such as the psychoanalysis, interpersonal relations, and the humanistic theories. So it's important for individuals to identify the application to the nursing process and how those concepts affect an individual's health and well-being. Other types of theories include cognitive theories and behavioral theories. Oftentimes, these are therapy approaches in combination, such as cognitive behavioral therapies. Looking just at behavioral therapy with B.F. Skinner may be a bit familiar to you in terms of operant conditioning or operant behavior, which is a type of learning where the focus is on the consequence of the behavior, not a specific stimulus. With cognitive theories, these are approaches on the internal thinking process. Beck believes that people with depression, for example, have a faulty information processing system that can then lead to biased cognitions. These may be faulty beliefs that cause error in judgment and become habitual errors then in thinking. These distorted or maladaptive thought processes or thinking strategies. Most often, interventions are based off of both concepts of cognitive and behavioral theories, providing therapies that are specific to both frameworks. Erik Erikson is a developmental theorist, specifically psychosocial development, where, as you know, he developed 8 stages that are organized by age and developmental conflicts, such as trust versus mistrust, autonomy versus shame and doubt. Be sure to look at Table 5.4 to help identify each of those different stages and conflict areas. Moving forward in the text, Hildegard Peplau is a nursing theorist that focused on interpersonal relationships, specifically the nurse-patient relationship and the impact that has on the patient's health and well-being. She believed in the importance of the environment and external factors and the importance of an empathic linkage with the patient and the nurse relationship. That linkage is the ability to feel in oneself the feelings experienced by another person, so putting yourself in another person's shoes. She also identified anxiety, which is a key concept that identifies the energy and expectations that are present or not met. So if anxiety is not recognized, then it'll continue to rise and escalate towards that panic level. She identifies 4 levels of anxiety: the mild, moderate, severe, and panic. One of the notes includes the fact that severe anxiety interferes with learning. However, mild anxiety can be useful. Another concept in Peplau's model is the self system, which is pretty similar from what Sullivan identified, which is a product of socialization. So the self goes through its own personal development, that's open to revision, but also leans towards stability. So this concept is pretty important when it comes down to identifying social-cultural environments and recognizing patients' patterns and the style of meeting their healthcare needs.